Anti-vaccine activists endured a cold, rainy day in Washington to make their point.
As parents, it's our decision whether or not we want to vaccinate.
The movement has gained so much momentum that doctors are alarmed.
We now in the state of Texas have 50,000 kids whose parents are opting them out of getting vaccinated.
Okay, hold tight, Mom.
Activists say that's because vaccines can cause everything from autism to severe allergies, and that the Centers for Disease Control is covering up studies showing harmful health effects. But that's not the case.
Occasionally there's an adverse reaction, but it is so rare that is to be almost unmeasurable.
The most common side effects to any of the vaccines are pain at the injection site and fever for 24 to 48 hours.
But the activists are convinced harmful ingredients are added to the vaccines.
Now it's aluminum that has been added as an adjuvant. Add to that formaldehyde, polysorbate 80, and significant amounts of human aborted fetal cell lines, bovine cells, pig, sheep, monkey, dog. These cells are not meant to be injected into the human body.
Again, the science says otherwise.
The vaccines that the children are getting today are very much more pure and are very safe and effective.
So effective that some diseases are no longer perceived as a threat.
Currently, if you speak with any young mother or young father in Italy, where I come from, they don't know diphtheria. They've never seen it. They don't know that you can lose your child from diphtheria.
The World Health Organization has an online site to help parents find reliable information on vaccine safety. The CDC does the same.
I think that there will be a certain number of people, a certain percentage of people, who no matter what you say to convince them with evidence, they're not going to be convinced. But I think the approach towards people who are anti-vaccinated is to respect their opinion and don't denigrate them and don't criticize them, but try to explain to them on the basis of solid evidence why the risk-benefit of vaccines clearly favors very, very heavily towards vaccinating your children.
And that's why Dr. Peter Hotez urges scientists to get out of their laboratories and to talk to people about vaccines. Otherwise, he says, children the world over will unnecessarily suffer and die from diseases that can be prevented by safe, effective vaccines. Carol Pearson, VOA News, Washington.